I'm Angela Poland, and I am the Head of Digital Programs for South East London, and I work for the South East London Integrated Care System. We've all attended an out-of-hours appointment or a hospital appointment where the person seeing us has absolutely no knowledge of our medical history, our family history, any repeat medications we might be on. And other key information as well. So the solution to this problem is the London Care Record. The London Care Record is a shared care record which pulls together information from all the care providers involved in my care across London, bringing the information together. So for example, if you live in Clapham in South East London and you happen to need to go to the emergency department of UCLH in North Central London, the emergency department will be able to see all your information from your GP in Clapham and any other person that's been involved, provider that's been involved in your care across London. What I've learned so far about the programme is the complexities and some of the challenges that are involved in rolling out a programme at regional London level. It's also the first time that I've worked with this particular supplier, Cerner. So it's also been really interesting finding out how best to engage with them to deliver this programme, especially when there's no centrally held London contract with them. We all contract individually across London. So one thing I think that has worked particularly well in the South East London delivery is the approach taken to set up a project team within each care provider. So this has quite a few advantages. Firstly, the team follows the internal governance within their own care provider organisation, so they're only sharing information they're comfortable with sharing. Secondly, they know their own internal processes, so they follow them no problem. And thirdly, you've got this key advantage of the care provider itself takes full ownership of the solution that they're delivering, so you can ensure that there's a better chance, high success rate of having a sustainable long-term solution moving forward. So a program like this is really heavily reliant on technical expertise, but there's only a finite pool of technical experts. So I think one of the challenges has been with this finite pool of resources, trying to coordinate across London when we're all engaging individually to schedule our delivery. So what I've really learned from the Digital Pioneer Fellowship is the importance and opportunities that having a well-established professional network can provide. So I think that has been a real insight to me. And also I've really enjoyed learning more about my own personal strengths and how moving forward I will be able to apply these to further my career development. The situation during the COVID pandemic has really shone a light on the importance of information sharing for providing healthcare like none other. So this has been really, really important. The London Care Record programme was actually accelerated March, April in 2020. And in South East London, one of the key things that we did was we made more information available, and we also granted access to more care providers to help them manage treating and caring for patients during the pandemic. So for an example of more information, Guy's and St Thomas's inpatient notes were made available, and a key provider that South East London gave access to was London Ambulance Service, which hadn't had access to London Care Record prior to that. And we've got great examples actually from Lambeth and Southwark Social Care, where their accesses during the pandemic multiplied by 3. So they were using it much more than they had previously used it. And this was really key to them being able to remotely carry out safe and quick discharge planning, remotely when they weren't allowed on the hospital site and didn't have access to the team. Also, by using the London Care Record, avoids unnecessary phone calls to the wards when the staff during a pandemic are so busy they don't have time to answer the phone. So I think that's been a real key success and achievement. Also for London Ambulance Service, who are new to the London Care Record, they use the London Care Record really frequently during the pandemic, and there's been some really good examples of how when the healthcare professionals are treating a person that they've never seen before, how the London Care Record is really key in being able to quickly tell them about the medical history, the repeat medications that they might be taking, and other information about the patient, which is really important if they've never seen the patient before, to deliver safe and fast care. Health system-wide programs like this one, it's really important to get your senior stakeholders engagement right up front at the beginning of the program. So this is really key because quite often you're asking a care provider to prioritise the delivery of your program over their own internal digital projects. So sometimes, especially initially, there may not even be a clear benefit to them of taking part. But then, of course, once all care providers are sharing information on the London Care Record, then the benefits are absolutely enormous.